something feels like it's afoot, doesn't it, NDP leader Claudia Chender?
Well, it does. I mean, it's nice to be here, Dan. I think this is a government that loves to govern by announcement, as we like to say, and certainly no time has that been more true than in the last week. This is what we usually see in spring at the end of a fiscal year when money is doled out to everyone the government thinks it's most strategic to give it to. Certainly, we're seeing that now, and we're hearing the same rumors that you are, which is quite something, given that this government's very first piece of legislation, their signature Bill 1, was a fixed election date next July.
Yeah, I remember the release vividly, something along that we needed to protect Nova Scotians against partisanship and electioneering and those kind of things, and now we're going just down that road, aren't we?
We certainly are. That's exactly what we're seeing is partisanship and electioneering. And, I don't blame the government for being nervous. They promised to fix healthcare. They haven't done that. So any government wants to go before things get bad. And certainly, given the lack of progress on their key promises, as we said, fixing healthcare, notwithstanding the announcements this week about the list and the retirement fund, the fact remains a huge number of Nova Scotians still don't have a family doctor, aren't attached to primary care. Wait times in emergency rooms for specialists continue to increase, and it's extraordinarily challenging to access the health care that we deserve here in this province. But, there's lots of other issues that people are facing. The cost of living, housing is something that, I've spent a huge amount of time just trying to convince this government to actually invest in housing that people can afford. Anyone from a new graduate to a working family will tell you that is a harder and harder proposition these days. So, we think that the government has a lot of work left to do, and they have time in their mandate to do it. And if we are going to the polls in the next couple of weeks, that's a pretty desperate step that shows that they understand that the electorate's going to catch up to them soon and realize that they haven't done what they said they'd do.
I think the last time, Claudia, you and I spoke, we were asking the government to release these numbers on the numbers of people waiting on the list, and they did it yesterday with this pronouncement that 20,000 or so people have been attached to health care. You have some concerns about those numbers, do you not?
Well, I think, we didn't have a ton of detail in the information we were given yesterday. That list has not been updated since June. We don't exactly know what methodology was used to take people off. We're not really sure, what attachment means to this province. But regardless, if we take them at their word that we have 145,000 Nova Scotians who are not attached to primary care, that is a number that is double what it was when the PCs took office. So we elected a government to fix healthcare, and it's gotten twice as bad. That's really what this announcement tells us. So I don't think we have to do any fancy math to understand that we're way behind the eight ball. And, I think that has a lot to do with the lack of focus. As we started this conversation, this is a government that loves to lead by announcements. So, they've been pouring money into all kinds of, opaque and questionable projects. So we've got the Hogan Court boondoggle where, tens, if not hundreds of millions of public dollars have been spent. We don't have a healthcare facility there yet. We've apparently sold the building to Shanex, but we're going to pay their mortgage. The government quietly announced a few months ago an unsolicited bid, to Google for $43 million. So that we can have a better search engine for hospital and doctor's records. That's great. I want people to have great search capacity. But Google walks into the Premier's office and says, give us $43 million, and the Premier says, sure. Meanwhile, we have 145,000 Nova Scotians who aren't attached to primary care. I think we have an issue of priorities. And I hope that that's something that Nova Scotians will take some time to look at in the coming weeks and months, because I really believe that with focus and a plan and commitment to do the hard work of actually attaching Nova Scotians to primary care, keeping people healthier longer so that they're not in our emergency rooms when they don't need to be, attracting more doctors here, we could actually start to move that needle.
Claudia, untendered contracts seems to be a thing, and we know that the government was taken to task over that by the Auditor General. Heard yesterday from Elizabeth Smith-McCrossin that the work that they announced this week on the Chignecto Isthmus, the $2 million to build that berm, was an untendered contract. That's not the way to do business in a government, is it?
No, we have seen an unprecedented use of what the government calls alternative procurement, what we would call untendered contracts with this government. Exponentially more than any government before them, and they have no reason for it other than they don't want to put things out to tender. They want to give jobs to their friends, frankly. And I know that seems like kind of extreme language, but I don't know what else to call it. The government kind of recognized, the Auditor General recognized that explicitly with Hogan Court. But yes, the Isthmus is a great example. This is a work that has needed to be done for decades, right? We understand the scope of the problem. People have been working for years in a dedicated fashion to understand what the solutions were. The government has spent much of the last couple of years grandstanding with the feds and not getting the work done. They decide to do the work, presumably, as you have suggested, in advance of an election so that they can make an announcement, and they don't tender the work. And when the Premier was asked about this yesterday, his response was, well, the work needed to get done. Well, yeah. We know the work needs to get done. The work has needed to get done for a really long time. We have a government that is not responsible with our money. They have had more revenues than any government before them. And, they spend that money however and whenever they want with as little transparency as possible. And that bill is going to come back to be paid. And it's going to come back to be paid by us and by our children and, by our province as a whole. We should be investing in Nova Scotia. We should be making smart financial decisions. And that's just not what this government is doing.
Back to the healthcare file, Claudia. This week, the Premier announcing, I'm going to call it a pension plan for physicians, and in order to recruit and retain the doctors that we have. Your thoughts on this, and when asked, because somebody asked the question at Cabinet earlier this week, will this work? And the Premier said, well, it isn't going to hurt. So that was kind of weird to me.
Yeah, well, this isn't a government that makes a lot of evidence-based decisions. But, what I will say is this pension plan, or kind of retirement benefit, which is what it really is, was negotiated by the government in their agreement with Doctors Nova Scotia. And in fact, it was promised last spring. So, I think the rationale is really that they negotiated a new payment plan with doctors, and part of that payment plan was to have some retirement benefit for physicians. I think this is valuable for a few reasons, and the main one is because we are actively trying to change the way that doctors practice. So we know that not every Nova Scotian is going to be always under the care of a primary care physician in the way that we might have been, or our parents. But what we are going to see more and more of, and much sooner than later, we hope, is health homes and primary care clinics where you have doctors and other folks working together. That's a different form. That requires a different form of payment for doctors, and I think they're saying, yeah, well, we would forego the fee for service that we traditionally have, because all of the doctors in this province are really kind of small businesses. So, we'll move away from that model to kind of being more like employees, but then we need to think about what our retirement looks like. So I think as a concept, it's fine. I particularly think I hope that it will be valuable for those new grads who are going to be coming out from a mountain of student debt and trying to decide where they want to practice, where they can start to address that. And so hopefully that will make us a more attractive jurisdiction for recruitment of those physicians. But, I think time will tell. And certainly, we would have liked to see more evidence gathered in the negotiating period with Doctors Nova Scotia so that the Premier would have a better answer than that. But the reality is we need more doctors, and this was something that this government promised in their election platform, promised in their agreement, are, quite late on delivering, but hopefully will move the needle.
Claudia, it seems that when we talk about doctors or nurses or healthcare professionals, that the answer that we keep hearing is that we just have to, spend more money on them, give them more money as for salaries or this pension or whatever else. Is that the entire solution? Do we just keep throwing money at recruiting doctors, or is there a feeling out there in the physician community that okay, the money is okay, but geez, they're going to work me to death here?
I think, when I talk to healthcare professionals, the number one concern actually is what their working life is like. And I think that's true for most people, right? Like, how do you feel about your job? Do you work in a toxic environment? Do you work in an environment that's okay? How do you feel about your colleagues? How do you feel about your managers? We have had a real issue, kind of a overall governance and workplace issue in Nova Scotia Health for a long, long time. It predates this government, and this government does not appear to have done a whole lot to fix it. So I think that is the other piece. And this is one of the reasons that we feel that so much more of the focus around transforming our healthcare system has to be on creating primary care clinics where Nova Scotians, we can get those 145,000 Nova Scotians off the list. And, I was really persuaded by Dr. Jane Philpott, who is a federal minister of health, has been on a campaign for this. There are places like Norway where you move somewhere and you get a letter and they say, here's your family doctor. Because doctors are like schools, right? You move into a neighborhood and you say, which school is my kid going to go to? And your kid goes there. Doctors' offices should be the same way. You move into a neighborhood, what's my primary care clinic? Okay, this is it, and then I'm going to go there. So to answer your question, when we ask the question with that model, well, how will we attract doctors? The answer is the conditions of care are the conditions of work. And so when you have patients who are cared for, who are happy that they get the care that they need, and doctors who work in collaborative teams where they have autonomy and they have time, that is an attractive proposition as an employment space. And certainly newer doctors, this is what they are asking for. These are the spaces where they want to practice. So I think, the other piece aside from remuneration and money is making sure that we have healthy work environments. And that for sure in the hospital setting means keeping hospitals open, making sure that the staffing complement is full, and making sure that people are supported. I mean, you mentioned Elizabeth Smith-McCrossin. The situation at the hospital up there is terrible. And we have nurses refusing work because they don't think it's safe because there aren't enough staff. These are the things that need much more attention from the health authority.
Claudia, we're just about out of time, but I want to ask you about the announcement to extend the government support, I'll call it, of the Yarmouth to Maine ferry. Your thoughts on that?
Well, I think it was sort of a non-announcement. They essentially said, we'll keep the ferry going through the contract in another year. I think that's a good thing. I think, we definitely I don't think any of the economic benefits that were sort of discussed in that announcement are news to anyone in Southwest Nova. But, I think what the folks down there are asking for, and what people interested in tourism in our province are asking for, is stability. So they need to know for investments, not just that the ferry is going to run this year and next year, but that we have a long-term stable contract. And so I think people are still asking that question. But certainly I think it's a big relief for operators down that way that this government's not going to pull the plug as many expected, given the Premier's hostile stance towards that ferry service, particularly in opposition.
We don't know the final bill yet, but last year was budgeted at $21 million. Is that money well spent, that $21 million?
Well, this is what the final study that the government's doing is going to tell us. But certainly I think, it looks like the preliminary results indicate that people who come here by ferry spend more than people who come here by car. They stay longer. And, I think if you look at tourism globally, the same is true for people who fly here. This is the same argument for more plane flights and more routes to come to Nova Scotia. The longer that people come, the more they spend to get here. Ironically, the more they spend when they're here. And that's good for our economy. That's good for our tourism operators. And that's good, for Nova Scotia, for all parts of Nova Scotia. So I'm cautiously optimistic, but like everyone else, we'll wait to see that final report.
Claudia, I appreciate the time.
Okay, thanks so much.
That is Claudia Chender, the leader of the provincial NDP.